Today's my topic is understanding self and the social behavior, motivation and the social attitude. First is the self for competency. First one is the understanding of the self, component of the self, identity, self-concept, self-confidence and self-image. First one is the self-concept. Look at this picture like in mirror to show of the how I am look. Is I am good or bad. Okay. And the first one is a line picture. There are so of the in the same like me, right? It is the self concept. First one is the self concept. Self concept is individual perception of the self and the what help to make each individual unique. Yeah, right? Means self concept means improve to the self, motive to the self, and the emotional to feelings to others and also to the self confidence. For second one is the positive and negative self assessment in the physical, emotional, intellectual, and the functional dimension change over a time. Means the always be positive, not to get a negative feelings in the mind, like a physical and also to like a negative feelings in the mind that time to affect the physically, means to show off the not properly to eye contact and also to the weakness to the body, and the in the mental is not stable, so that time to the more affected to the body parts. Self concept affected by the ability to function and the greatly influence the health status. So whenever the problems occur, that time to the self confidence low, that time occur the health, that time to the health weakness occur. Self concept, self knowledge. Who am I? That time whenever to like a self confidence, let that time to say like that. Who am I? And what I want. So to the improvement to the health and also to the expectation. Social self, how a person perceived to by others, means what thinking about me, and like some people's like he is not a good person and is always like an angry man, right? That time to say that always be positive and not to get a negativity in the body. Self evaluation, how well I like myself, right? When I love myself, I do everything. Be positive. Okay. Components of the self concept: self-esteem, identity, role performance, and body image. Explain in the slides. Components of the self concept in the same: self-esteem, body image, role performance, and identity. Components of the self concept. First one is the self identity, a sense of the personality identity. What sets one person apart as a unique individual. Means each and every person like a personality is a unique, right? Me in my friend is a both her personality is a different and identify like a behavior, personality, status also. And second one is identity include a person name, gender, ethnic identity, family status, occupation, and the rules. Means what to identify in the person like a name, different name, girls or boys names, different gender along, edit gender difference, ethnic identity, means what is the status, family status, occupation, like as a nurse, as a doctor, as a staff nurse, right? What and the roles, different roles to the follow. Once person identify the identity begins to develop during childhood and the consistency reinforced and the modified through the life. Means when was your child that time to like a some uh, some activity like to do some activity to do like that playing always to playing or always to like to do watching TV, but changes is the modified, changes is the most important in the life, like a modified like in adult to in adult time to all understanding level is a high and to improve the knowledge also. Components of the self concept. Second one is the body image. Body image is the attitude about a one's physical attribute, characteristic, appearance, and the performance. Means body to image. What is the so? Means what is the structure and the function of the body? And appearance means personality. Means a face-to-face eye contact, and the personality, how to the clothes needs or not. Second one is the body image is dynamic because any changes in body structure and the function, including the normal changes of the growth and development, can affect it. Means what? Childhood period, adulthood, and the old age. The body function is a different, and the growth and development also to the improvement. In the adult to grow to the mind and also to the physical. Third one is the self-esteem. Self-esteem is the judgment of the personal performance compared with the self-idol. Means what to do and what to the self self-protection, self-esteem. What is the performance in the going on? Self-esteem is derived from the sense of giving and receiving love, being a respect by others. Means all people to give a care, love, care, respect, and support. Right? Next is a role performance. Roles refers to the set of expected behaviors determined by a familiar, a cultural, and the social norms. Means what is the different roles? Like a student's roles difference in the family roles. Family roles are different, right? So some are specific roles in the different way. Depend on the work or depend on the profession. The level of the self-esteem is depend upon the self-perception adequate roles performance in the various social roles. Right? I said that already. In the student's life, in the job, and the different roles in family also. Develop of the self-concept means improvement to the self-concept. Self-concept evaluated throughout the life and depend on the extent on the individual's development level. Means the improvement, the development levels depend on the work. Formation of the self-concept. Infant learns a physical difference from our environment. Means the depend on the person, depend on the condition to the changes to self-concept. If basic needs are met, a child has a positive feelings of the self. Means whenever to the basic needs, means what to do and what to want. Means to the understanding level, feelings and love and care and support to the self and also to the child. And what want to like child means to understanding love, care, affection, effectiveness, right? Child interaction, others people attitude towards the self means the self-confidence to the improvement and the attitude means the see whenever was a child that time to do not to get the well understanding, so it's a so many problems occur. So that time to what can do the group interaction, communication, and the what is effective for a child. So that time to the like of watching videos and how to improvement child or adult internalization standards of the society. These are what is the scope of the society and the social medias. Factors affecting the self-concept. Alternative health status means to see the health status. Experience. What is the experience? Like a competitive degree or the like a job experience, and also to the how to explain and how to understanding level. Development consideration means to implement the development, right? Means how many going 2 years that time to the improvement, the like improvement the mental health status and the also to the health, cultural, internal and external resources. Means what is affected by internal or external resources. History of the success and failure means so many times like a success in the life and sometimes is a fail, but all history to the made like a successful the life and the two done by so many stories. Crisis of the life pressure many times to the stress occur that time to what can do to spend time with her lifestyle and to share the feelings with her friends or family. Aging, illness and trauma means depend on the age to affect the self-confidence. helping patient maintain a sense of the self. Communicated with look, speech, and the judicious. Means what? Whenever to talk any person, that time to speak to speak clearly and proper sentences. Acknowledge patient status, role, and the individuality. Means their knowledge provide to the patient. Speak to patient respectfully. Give a respect and the other respect. So what can do? Speak to patient like a sir or madam. Offer simple explanation of the procedure. Means before or after procedure to explain the procedure. Explain procedure for the patients. Move patient the move patient bodies respectively if necessary. Means depend on the condition to the move the another ward or the hospital. Respect patient privacy and sensibility. Means maintain the privacy of the patient. Acknowledge and allow expression of the negative feelings. And last one is the help patient recognize strengths and the exposure alternative. Thank you.